Let's talk about doing kick counts for your baby. Hi, I'm Dr. Toya, board certified OBGYN, and I want to talk about doing kick counts during the pregnancy because there's newer data that shows that it's actually not associated with improved outcomes in pregnancy, which just means that we don't know that it's helpful. So they've come under fire a little bit, especially because there can be weak associations with more interventions. So more induction of labor, more C-sections, things that we may not necessarily want. With that said, I still think there's use for it clinically, but only in very specific scenarios. After 28 weeks, which is the only time I recommend monitoring baby's movements anyway, usually pregnant people can recognize a pattern in their baby's movements. And these are the two scenarios, like I mentioned. One, if your baby is not moving according to your usual pattern, so if baby moves a lot at night, baby wasn't moving a lot or not at all at night all of a sudden, then that could be concerning. Or if you have just been so busy, so preoccupied that you don't even know if baby is on the pattern, that's another time that you can utilize the kick counts to reassure yourself. So how you do the kick counts, and there's some variation, but this is in general what's recommended. So you want to make sure that you've had something to eat or drink, something cold or sweet that's going to stimulate the baby. If you are dehydrated, if you are hungry, baby's not going to move as much. So that's why we recommend that. So you go into a quiet room by yourself, no distractions, make sure everything is focused on the baby. You lay on your side and count baby's movements. You should have 10 movements in 2 hours minimum. And if it's less than that, then you do need to be evaluated. Contact your midwife, contact your doctor. And when we say kick counts, I just want to be clear. Any movement counts. So especially as the baby gets bigger, you may not feel like wild kicks like you did early in the pregnancy. Any little movement counts as a kick. So don't only look out for an actual like boom kick because it may not necessarily feel that way. I really do think daily kick counts, like using those apps or anything like that, are quite a waste of time, especially because the majority of people have like a consistent pattern that they recognize after 28 weeks, like I mentioned. And again, it's one more thing that you have to do during the day that could potentially induce anxiety, which we're not doing that, right? So let me know if you have any comments or questions, and like and follow for more.